Thalassemia, an inherited blood disorder. Highlight in blue information that matches Alexandria's case. Highlight in red items that do not match Alexandria's case. What is thalassemia? Thalassemia is an inherited blood disorder that causes your body to have less hemoglobin than normal. Hemoglobin enables red blood cells to carry oxygen. Thalassemia can cause anemia, leaving you fatigued. If you have thalassemia, you might need treatment. But more severe forms might require regular blood transfusions. You can take steps to cope with fatigue, such as choosing a healthy diet and exercising regularly. Diagnosis of thalassemia. Most children with moderate to severe thalassemia show signs and symptoms with their first 2 years of life. If your doctor suspects your child has thalassemia, he or she can confirm a diagnosis with blood tests. Prenatal testing. Testing can be done before a baby is born to find out if he or she has thalassemia and determine how severe it might be. Tests used to diagnose thalassemia in fetuses include chorionic villus sampling, usually done around the 11th week of pregnancy. Sorry, that's not villus, that's villus. Chorionic villus sampling, usually done around the 11th week of pregnancy. Amniocentesis, usually done around the 16th week of pregnancy. What are the symptoms of thalassemia? There are several types of thalassemia. The signs and symptoms depend on the type and severity of your condition. Symptoms can include fatigue, weakness, pale or yellowish skin, facial bone deformities, slow growth, abdominal swelling, dark urine. Some people have only one affected gene and don't have a symptom. Thalassemia continued. Below are the common symptoms of thalassemia. If Alexandra has the symptom, drag it over to the purple box. The common symptoms of thalassemia include fatigue, weakness, pale or yellowish skin, slow growth, abdominal swelling, facial bone deformities. Most likely, you're not going to have that many of them put into the purple box, okay? Thalassemia treatment. Mild forms of thalassemia don't need treatment. Moderate to severe treatments might include blood transfusion. More severe forms often require frequent blood transfusions, possible every few weeks. Chelation Therapy. This is a treatment to remove excess iron from your blood. And stem cell transplant, also called a bone marrow transplant. A stem cell transplant might be an option in some cases. The procedure involves receiving infusions of stem cells from a compatible donor, usually a sibling. Sickle cell anemia, an inherited blood disorder. What is sickle cell anemia? Sickle cell anemia is one of a group of disorders known as sickle cell disease. Sickle cell anemia is an inherited red blood cell disorder in which there aren't enough healthy red blood cells to carry oxygen throughout the body. Normally, the flexible, round red blood cells move easily through blood vessels. In sickle cell anemia, the red blood cells are shaped like a sickle or crescent moons. These rigid, sticky cells can get stuck in small blood vessels, which can slow or block blood flow and oxygen to part of the body. There is no cure for most people with sickle cell anemia, but treatments can relieve pain and help prevent complications associated with the disease. Diagnosis of sickle cell anemia. A blood test can check for the defective form of hemoglobin that underlies sickle cell anemia. In the United States, the blood test is part of routine newborn screening, but older children and adults can be tested too. What are the symptoms of sickle cell anemia? Signs and symptoms of sickle cell anemia usually appear around 5 months of age. They vary from person to person and change over time. Anemia, too few red blood cells, swelling of hands and feet, episodes of pain, frequent infections, delayed growth or puberty, vision problems, and stroke. Below are the common symptoms of sickle cell anemia. If Alexandria has that symptom, drag it over to the purple box. Now pay attention to these choices because it looks like a lot of them are what Alexandria has.